My name is Navjot Walia, and I'm graduating with a bachelor's in nursing science. It was a hard journey, and it was like late night studying, a lot of tears. But I wouldn't change anything about it because I've learned a lot from it, and I've learned, that you have to work hard in order to pass and get through this. There's no other way. There's no shortcut. I went to Cal State Long Beach after high school. But since it was a little competitive to get into the program there, so I decided to do half of my prereqs at a community college, and then I transferred all my prereqs to the school, and I got into the program right away. And it took me 2.5 years to complete it. I think I've always wanted to be a nurse since elementary school. I remember talking to my mom about it, and she told me, she asked me, what do you want to do when you grow up? And I told her a nurse. I don't know, I guess I just have that personality to help others. And I kind of just used that as my way of pursuing nursing. But it wasn't until I started volunteering that I realized, okay, this is what I want to do for the rest of my life. I volunteered at a Long Beach VA hospital in the ER. And it was hectic, but it was very rewarding, and it was very fast pacing, and which I liked, and that's what kind of motivated me, this is what I want to do. I think because I was a volunteer, it wasn't that hard for me to keep up because they don't really give you a lot of things to do, but I think it's just time management. And because especially at ER, you get a lot of patients that are just coming in and not enough beds. So what my job was to, if there weren't a lot of beds available for the patients that are waiting outside in the waiting area, I would have to get their vital signs and report it to the nurse. And that's what basically I did. And then once there was a bed ready for them, I would clean up all their beds and stuff and transfer the patients to their rooms and tell them, you have to get dressed and then the doctor will come see you. So it was time management. I think the main focus is the 12-hour shifts that we have to do. And I think the way the school prepared us is by our clinical hours. So we have to stay there the whole 12 hours in order for us to get used to the idea of the 12 hours and how we're going to be. So I think that's what the main focus was, and that's what helped us. I just want to say thank you. Thank you for all the support, for helping us, with everything. And also just being there for us, even for emotional support, was really appreciated. And yeah, thank you. Thank you for everything.